So today I'm going to be talking about alternative payment models under Medicare. Traditionally, payment was made for specific services or illnesses treated, but nowadays we've been seeing a shift toward value-based care that stresses accountability to the provider. Bundled payments reimburse multiple providers for coordinating total services through an entire episode of care. So basically, they're all paid a one lump sum for all of the services performed and divvied up between all of them. And this includes rehabilitation or therapy services. And within this model, it shifts the financial risks more on the providers than ever before, as traditionally with the fee for service, it's more been on the insurance company instead. And within this model, the providers share either the profit or the financial loss associated with this model. So one of these models is the comprehensive care for joint replacement model. This is a bundle payment model that involves total knee and total hip arthroplasty episodes of care. And this spans from the inpatient stay all the way through all of the post-operative care up until 90 days after discharge. It was started April 1st, 2016 within 67 metropolitan statistical areas, and it's been trialing for 5 years. Estimated cost savings of 153 million have been calculated, which is pretty astonishing. That's a lot of money. Hospitals are required to participate if they are within those metropolitan statistical areas, and they're also required to report two quality safety measures, the NQF 1550, which is a complications measure assessing risk standardized complication rates 90 days after the procedure, as well as the hospital consumer assessment of healthcare providers and systems. Beneficiaries within the system still have the freedom to choose any provider with no restrictions. And the new proposed physician fee schedule in 2017 included an expansion of this model to include hip and femoral fractures, which these nowadays only include the voluntary surgical procedures. It also includes bundled programs for bypass surgery as well as heart attacks. Another example is Bundled Payments for Care Improvement Initiative, or BPCI, which began January 31st, 2013, and included 4 models of care, which I've listed below. Model 1 was an introductory model, and it concluded January 31st, 2016, but it only focused on acute care hospital settings only. In Model 2, the episode of care includes inpatient stay in the hospital, as well as post-acute care and all the related services during that entire episode of care, up to 90 days after discharge. In this model, actual expenditures are reconciled against a target price, which was set by CMS for the episode of care, and either a payment or a recoupment was made based on that target price. And that goes for Model 3 as well, as it was a retrospective plan, just like Model 2. However, Model 3 only includes the post-acute care. Model 4 is the most progressive, as CMS makes a single prospectively determined bundled payment to the hospital that encompasses all the services provided by the hospital physicians and other practitioners during the episode of care in the acute care hospital only. And then if you go to the next slide, you will see a nice table that kind of summarizes things nicely. As a physical therapist treading through this ever-changing healthcare environment, it may be a struggle to find how exactly you can prepare yourself for these upcoming changes. So it's really important to become familiar with the model itself and the environment around you when considering participation within one of these models. You really want to learn as much as possible about fellow collaborators or providers that you may be working with. Adopting a collaborative mindset and being an active partner within one of these models is of the utmost importance, because you're really trying to increase quality while decreasing costs throughout the entirety of the episode of care. And that's pretty difficult to do if you're not collaborative and being active together. You also really want to know your value and your outcomes over cost ratio when considering participating. And you also want to know the risks, potential risks of participating and potential risks of not participating. You want to know the logistics of your business practice, Before participating, you want to know the cost, the risk-benefit ratio, your target patient population, because if the patients that you're going to be seeing aren't the ones that you're targeting, you may want to switch that around. You really want to know all of the logistics and financials of your business or practice before you participate. Your costs, your risk benefit ratio, your cost per diagnosis, your target patient population, all of these things you really need to know before even thinking about participating. It's also important to use evidence-based practice all the time, but especially within one of these models. You want to review each contract in its entirety and understand what's expected of you, what's expected of the other providers. That is essential in preparation into entering one of these models. Also, the APTA has two great alternative payment model contracting guide and checklist up on their website. They are very helpful, and they basically spell out questions that you should ask yourself as well as others before participating in one of these alternative payment models. And lastly, I just wanted to say communication. That is key within one of these models. You really want to increase your communication and know how much you guys communicate and understand each other within your clinic as well as with the other providers. The next slide is just a pros and cons list for bundled payments that I pulled off the contracting checklist, so you guys can check that out. And I just wanted to end with really the future is the new alternative payment methods, the bundled payments. The old fee-for-services are fading away. Value-based care is the new trend, focusing on quality and reducing wasteful spending.